Can you switch from one Medicare supplement plan to another? The short answer is yes. In this video, I'm going to break down when you can switch, why you'd want to switch. There are certain times, there's certain things that you want to know before switching and when looking from one to the other. All right, so if you didn't already watch some of our other videos where we go through underwriting and Medicare supplement plans are secondary insurances to Medicare. They simply pay the bills second to Medicare. They are not like regular health insurance where you can only change one time a year. That would be Medicare Advantage and Medicare Part D drug plans. So just like regular straight up Medicare, once you go on it, you're pretty much on Medicare forever. But the supplement plan is a secondary plan that you pay for. So when those premiums start to go up, you're looking around and saying, should I change? Can I switch? A lot of times people wait until the open enrollment, and that is really a mistake. You do not want to wait till open enrollment because it gets so busy during that time of year. And it's really called annual enrollment, but that time of year gets really busy. That's when you can change your drug plan, and you're seeing all these commercials for Medicare Advantage plan. You can actually go ahead and apply to change your Medicare supplement plan at any time. When do you want to do that? Well, you want to do it when your premiums go up. You want to just take a temperature. It's just like all your other insurances, your homeowners, your car insurance. When those bills start to go up, you're like, is it time? Should I be looking at it? Yes, you should be looking at it. You should be looking at your Medicare supplement plan. We always reach out to our clients to make sure that, we're checking up for them, but you can't always rely on that. So if you got a rate increase, great time to shop around. Other reasons why or when you can change your Medicare supplement plan, if you're in an old plan, the Medicare supplement plan F, G, N, those are the most popular plans. Now, F is no longer available for people turning 65 to choose from, and some folks are in this wonderful F plan, and they love it, they love it, they love it. They just don't love the price tag. The price tag matches the fact that if you have traditional Medicare with Plan F for fantastic, it covers everything. So you go to the doctor, you're hospitalized, you have physical therapy, you have nothing to pay. Medicare pays the bill first, and the F plan pays second. Well, that's fabulous. If you have a lot of medical stuff, you don't want to worry that you're going to get stuck with this big bill. So we love Plan F, but we don't like the price tag. So sometimes we recommend choosing a different letter. Like a Plan G, for instance, that is the new Plan F. That is what people call the Cadillac plan. The Plan G, just like the Plan F, will cover your hospital 100%. So if you're hospitalized, you could be in and out of the hospital. You could be in there 365 days. You will not get a bill. That $1,700 plus deductible that is on the Medicare Part A, like if you didn't have the supplement plan, is picked up by Plan F, also Plan G. So that's fabulous. So if you're hospitalized, you pay nothing. The thing about the Plan G is that it costs a little bit less than the Plan F, okay? So it's a better option for a lot of people. And the reason why it's less money is because there's one difference. You are responsible for the Medicare Part B deductible, which is somewhere around $300, okay? So with the Plan G, you are paying the Medicare Part B deductible, and then Medicare's paying 80% and the G plan pays 20%. Wow. You go for physical therapy, you have medical tests, your doctor visits, everything is covered. And what's really awesome about a Medicare supplement plan is that there are no networks. It's the Medicare network. So you can go to any doctor across the whole United States that takes Medicare which is about 95% of providers across the country take Medicare. So Plan F, Plan G, awesome. They give you the freedom to choose and peace of mind to not worry about big out-of-pocket expenses. But if you're in that Plan F, no new people are going into that Plan F because it's no longer offered. You can stick with it if you want it, but those premiums keep going up. If you know anything about insurance, it's a risk pool. So if you don't have younger people going into the plan or people who are healthier or it's not available anymore, the cost of that F plan is going to go up because they're going to spread the risk. So you may want to think about changing to the Plan G, okay? So great option. The other plan is Plan N. We're seeing a lot more people navigate to Plan N because it has a more attractive price tag. It is a Medicare Supplement plan. It is a Medigap plan. Just like the Plan F and just like the Plan G, you're free to choose any doctor across the United States. No networks or referrals. You don't have to worry about prior authorizations to get approved for your MRI or your surgeries. You don't have to go through any of that. It covers the hospital or the Part A expenses exactly the same. Just like the G plan, you are on the hook for the first $300 or so for the Medicare Part B deductible. Each year that changes in January, but you're on the hook for that deductible. And then unlike the F and the G, the price tag for the N is slightly less and you have a copay. The copay is $20 for any kind of office visit. An office visit to see your doctor, a specialist, a medical practitioner, it's a $20 copay. And then a $50 copay for the emergency room, okay? So Medicare Supplement plans, Medigap plans, they're interchangeably called Supplement Medigap plans. They are standardized by the federal government. So every F is the same, every G is the same, every N is the same. It doesn't change in how it pays out. So the N plan offers you a lower monthly cost and a little bit more out of pocket. For some folks, that is more palatable to change to a letter that costs a little bit less in the money, and they're okay with the $20 copay. They're not going to the price difference between F, G, and N. It's about $40 to $50 between each letter. So if you think about that, if you think about it, if you had to lay out $20 for an office visit and you're saving about $40 to $50 from Plan G, does it make sense to like save a few dollars? Are you going to the doctor twice a month? Plan N probably would work out. Now there is something called a Part B excess charge, which is very rarely charged. If you're worried about that, then you might want to stick with the Plan F and the Plan G. But ultimately, the Plan F, the Plan G, the Plan N, those are the most popular plans to choose from. So the question we started out with was, can I switch my Medicare Supplement plan at any time? Yes, you can. And one of the reasons why you may want to switch is because of the price. Now, there is a proper way to do this. So make sure that you understand you're not just simply dropping your Medicare Supplement plan and just moving over to the next one. You have to go through an application to apply for Plan N. If you want to go from Plan G to Plan N or vice versa, you have to go through the application. So you always want to keep your existing plan in place and then put the application in for your supplement plan, the new one that you're choosing, and see if you're accepted. The other thing is, yes, you can switch companies. You may be in a Plan N or you may be in a Plan G that the price is going up and you simply want to save a few dollars. You want to save a few dollars, same coverage, different price tag, okay? So those are reasons why you'd want to change, but the key is you want to put the application in to see if you're accepted before you drop your supplement plan or try to change it. I would suggest that you work with a broker, someone who could shop for you. We do that all the time for our clients. It really helps because there's different underwriting rules. If you found this video helpful and you are looking for just general information on Medicare Supplement plans. We have an amazing report. Go ahead and watch our video, Can I Change My Medicare Supplement Plan at Any Time? And you'll have access to that free report that gives you so much information about Medicare and Medicare Supplement plans.